Live from the SABC's Auckland Park headquarters, welcome to this Thursday edition of the Watchdog. My name is Vuyo Mvogo and thank you for watching. Here's what we have in store for you this evening.
Politicians mine it as voting fodder, whilst ordinary people scramble for resources.
With phenomena such as Operation Dudula and certain political parties further complicating things, civil society formations, academics want to put pressure on the cabinet and parliament to effectively tackle the polarizing nationalism and xenophobia manifesting itself in issues around employment and business opportunities for foreign nationals. We speak to the convener of the initiative, Professor Thuli Madonsela, whom you just saw there. And South Africa signs a new 8.8 billion rands global fund grant for HIV, TB and malaria. We look back, where has the money been going to achieve what exactly, especially in light of NGO complaints about being neglected and sidelined, and patients who are harassed and underserviced, especially at public service hospitals. The CEO, as well as the co-chairperson of the South African National AIDS Council, are our guests this evening to answer some of those questions. All that and more coming up in tonight's episode of The Watchdog, which starts right now. South Africa's fight against HIV, AIDS, TB and malaria today received a shot in the arm. Global Fund has announced a grant valued at 8.8 billion rand for the next 3 years. Health Minister Dr. Joe Phaahla says this bodes well for the healthcare sector. Phaahla took part in the signing ceremony in Pretoria alongside key stakeholders in the fight against HIV and AIDS. Kaelihle Khumalo attended the signing ceremony.
For the past 2 years, the fight against HIV and AIDS took a severe knock as attention mainly shifted to the COVID-19 pandemic. But it's been a turning point in Pretoria as the Global Fund has announced a massive cash injection to regain lost ground in the fight against HIV, AIDS, TB and malaria.
This is a major contribution to our fight against HIV, TB and malaria and sexually transmitted diseases. But you know, these are public funds because these funds are from donors. Some of the donors are governments, including our own government. As you would have heard that the US over the last 20 years have contributed just over 20 billion US dollars. France has contributed just over 8 billion US dollars.
In countries where the Global Fund invests, AIDS-related deaths have been reduced by 65% and new infections have also dramatically gone down. The National AIDS Council has also thrown its weight behind the additional resources, saying the fight against HIV and AIDS cannot be overlooked.
We've seen the coverage of medication that prevents mother-to-child transmission of HIV increased from 71% in 2010 to 95% in 2020. We've seen the success rate for treatment multi-drug resistant TB increasing from 40% to 60%. The number of HIV patients with TB who have access to ARVs increased from 54% to 85%.
The government has urged people who have not had their HIV and AIDS treatment since the outbreak of COVID-19 to approach healthcare facilities.
We want to say that it's safe. We've learned a lot. Even as I say, we never actually closed health facilities, but there are a lot of inconveniences in terms of how health facilities were organized at certain levels of high levels of COVID. But now we've had a lot of experience. We're making sure that the COVID work it does not interfere, and people will not really end up standing too long.
The Global Fund's investment case for 2024-2026 estimates that the total funding needed for that period is over $130 billion to get the world back on track towards ending HIV/AIDS, malaria and TB by 2030. Kylie Khumalo, SABC News, Pretoria.
Well, joining us to take stock of the country's current HIV and TB programs, as well as enlighten us on what the money is going to be used for and what it's intended to achieve. Please welcome SANEC CEO, Dr. Thembisile Xulu. Welcome back, Doc. Please unmute. Okay. Hi, Doc. Okay, she seems to have a problem. Steve Letzike, SANEC co-chair, welcome to you too.
Good evening to you, Vuyo, and to the viewers of SABC. Thank you.
Thanks to both of you for coming on this evening. I mean, from that insert prepared for us by Kylie Khumalo, you seemed to suggest that we are winning the war. Would that be an accurate thing to say?
Look, Vuyo, I think we need to be very clear, that South Africa has seen significant progress in the HIV response. And this progress speaks from, the reduction we've seen over the years around reduction of new infections, not to the extreme target that we have set for ourselves, but there has been progress. Similarly, this is a reduction on HIV and TB. Similarly, we're talking about treatment and access, equitable access to treatment, which is also another boost for South Africa. The challenge is whether are we able to reach the target we set for ourselves. We had promised ourselves that we will be below 100,000 by the time 2020 hits. We were not able to reach the target because of the social behavior challenge that we're still dealing with in society. We as a council can't prevent HIV infection. People need to prevent HIV prevention amongst themselves, which then boosts their behavior. Second, treatment. Treatment is available, is free, and actually every person who is diagnosed HIV positive have got access to treatment immediately, can be initiated. So there needs to be an uptake. And this is why, as a country, we have been implementing programs, from government, civil society, and private sector to say, take up and let's work with society. And as civil society, we have been working to speak and to change the behavior around that. So I think there's progress, there are challenges, absolutely. And there's also been COVID disruption for that matter, which may have potentially set us back, but we are very much confident that we will get back on track.
Have you been able to put a finger, on the problem of social behavior? Do we know what is contributing to that, given the fact that, by now everyone knows about HIV and AIDS,
sure,
and so much effort and money, has been put into it all?
Absolutely, Vuyo. Look, if there's one thing that we know as a country, we understand our epidemic. First, we were able to understand the populations that are key and are at risk, and those that are vulnerable. for that matter. So whether you talk about the vulnerability that, sex workers, men who have sex with men, transgender women, and similarly adolescent girls and young women, the scientific evidence that have been brought forward by many of the research sector has actually used different models to actually tell us where the infection rate is coming from. So whether you're talking about adolescent girls, who we have reported the 800 new infections per week, which is unacceptable number of girls between the ages of 15 to 24. These girls are not infecting themselves, by the way. They're infected by older men in communities, in societies that often also may potentially be known to them. Secondly, is that whether we're able to address the social and structural challenge, whether it's an economic challenge, whether you're talking about patriarchy and toxic society we live in, so we understand the epidemic and we know exactly what needs to happen with the response. And our national strategic plan, which has 8 goals, have articulated the interventions that ought to be done by government, by civil society, and other stakeholders for that matter.
In fact, social, structural problems, the problem of patriarchy as well. In fact, you are reminding me, Steve, of a conversation we had here on the program not too long ago about the problem of children who are being impregnated by people, as old as their grandfathers, children as young as 10 years old being impregnated. Obviously, this is not something, an organization like the South African National AIDS Council and its partners can solve all by yourselves.
Absolutely. And this is why the National AIDS Council is a multi-sectoral body. First, we were established in 2000 at a time where we were desperate for response. We were in denial as a country. Many people we've lost due to stigma and discrimination for that matter. And what we have significantly done was to call for collaboration that responds to this. Government cannot deal with this alone. And actually, government is not the answer. Society and community is the answer. Now, the most important thing about all these different investment is we have to look at this contribution, whether we call it financial boost and so forth. It's actually an investment on healthy population that have significantly seen, even with the results of high increased levels of age or even of life expectancy for that matter, have demonstrated that we can do it better as society.
Dr. Xulu, you've been on the job for how many months now? I remember our last conversation, you were talking about how you were turning things around and so on. Just take us back a little before we get to, the 8.8 billion rand grant that actually triggered this conversation. Over the past few years, where has this money gone to? What has it been, used for?
Vuyo, and good evening to your viewers. I hope you can hear me now. We've just had our lights come back, so I had to switch to Wi-Fi. Am I audible?
Yes, you are indeed. Thanks very much.
Thank you so much. All right, so the Global Fund has been a strategic partner to the South African TB HIV response as part of the multi-sectoral players, which CSF Chair has referred to, being government, civil society, private sector, development partners, as well as organized labor. And the type of support that Global Funds actually adds to is to make sure that we as a country achieve the goals of the NSP. And how that is normally done is that the Global Fund has got an in-country board called the Country Coordinating Mechanism. And this country coordinating mechanism does consultations at a countrywide level to determine what are the needs at community level. One of the key things that has come up, which has solely been funded by Global Fund over the years, for instance, is the human rights around people with HIV, TB, and STIs. So Global Fund has been the international donor that funds that. Global Fund has contributed significantly to prevention interventions that relate to key and vulnerable populations. I think most of us will know, Vuyo, that our key and vulnerable populations are highly vulnerable in terms of new infections and do require priority in terms of access to prevention services, especially because of the stigma that surrounds, communities like MSM, sex workers, people who use drugs, etc. So Global Fund has been a key partner in terms of that. What they've also done is to inject further funding beyond what government is doing, as dictated by the TB prevalence survey, for tuberculosis. Tuberculosis continues to be the #1 cause mortality for people with HIV. And what Global Fund has supported is finding the missing TB patients, making sure that patients get access to X-ray. And in this particular round, we are proud to say the Global Fund investment to TB, in terms of the 8.8 billion, has increased from the last round, where the proportion was 8%. It's now 26% ring-fenced just for TB intervention, based on the TB crisis that the country faces.
Can I stop you right there? Because as you would have heard from my intro, I mean, we've been having conversations here on the back of, the TAC, doing, surveys about how people who are supposed to benefit from these programs were treated in the public sector in particular. And it wasn't a particularly good picture that they painted. They continue to be, looked down upon. They continue to be treated badly by some of our public servants at hospitals. A lot of prejudice that they encounter there. And these are issues that they've been raising with provincial health authorities across the country.
Thank you so much, Vuyo. I think if you look at Goal 5 of the National Strategic Plan, it really speaks to human rights and a human rights-based approach. And this speaks to protecting the human rights of people living with HIV, as well as other key and vulnerable populations, and anyone actually that's accessing health services. So there are programs that the Department of Health has put forward, for instance, around supporting and training healthcare workers in terms of giving equal and fair and just access to all key and vulnerable populations. But at the same time, there's been a lot of advocacy work driven by our civil society colleagues, because it is important that we allow access to key and vulnerable populations if we are going to conquer the war against HIV and TB. So I think it remains a concern, because when you look at stigma, it is multifaceted. And when you add the picture of COVID into it, then mental health issues come into play, not just for our patients, but for our healthcare workers themselves. So our partners in terms of donors, as well as government, have invested also in programs to assist with the mental health of the healthcare workers, as well as the patients, just to make sure that patients have got equal and fair access, in order to address the issues of stigma, especially the stigma that emanates from healthcare services, where our patients are freely supposed to access services, irrespective of their sexual orientation or their HIV or TB status.
In fact, I want both of you to take a listen to Malaria, who's the TAC General Secretary, just what he had to say the last time he was on the program. It sounds to me like it's the problems we've been having since. In other words, these are not problems that started with the advent of the coronavirus pandemic. These are problems that have been there for the longest time. Would you agree?
Yes, I will agree with you 100%. You will remember, Vuyo, that in South Africa, we've got, firstly, before the advent of COVID-19, we have been having a lot of posts within the health department which are frozen. Our healthcare workers are overburdened, are overworked, and they are human beings. At times, they will make these mistakes. And we strongly believe that if the Department of Health can make sure that we hire more nurses, not on contract basis, on permanent basis, then that will lessen the burden of work many healthcare workers are faced with in our clinics. Lastly, in these clinics, or in these 27 districts, in 2019, when Minister Aaron Motsoaledi was still the Minister of Health of South Africa, they promised PEPFAR that as part of a turnaround plan, they will come up with a 10-point plan. One of the things the Department of Health of South Africa promised to PEPFAR with regards to these clinics was to say some of these clinics will open extra hours. Instead of closing by 5 o'clock, they will close 8 o'clock. Some of these clinics will open on weekends. And when we went down on these clinics, we found out that the promise that was made by the South African government with regards to these clinics has not been fulfilled, because some of these clinics are closed by 5 o'clock. Some of these clinics are not opened on Saturday. So these are some of the issues that we feel that they need to be addressed, because when you engage at the facility directly to say, according to the statute, you are supposed to close at 8 o'clock and you are supposed to open on Saturdays. They will tell you that that was the national arrangement. At local, we don't have an arrangement like this, because it must cover issues of overtime allowance, issues of extra staff. So in some areas, the national department takes decisions, and those decisions are not communicated at the provincial level in order for them to be implemented to ensure that the quality of services for health is improved for all in South Africa.
In fact, Dr. Kolo, Ndivua Rambao, who we had on another program, added to the list, that Aneleyawa there, spoke about, and he was raising another set, of problems, some of which, Dr. Kolo, you alluded to. I want us to take a listen to what Ndivua had to say on the day we had him on the program. Openly hostile, especially abusive. Only some of the words respondents to the survey used to describe their experiences at the hands of supposed professionals within the public sector.
Essentially, that was one of the key themes that we found in the data as well as in the report. So facility staff attitudes, by and large, revealed that, public health facilities were less friendly towards key populations compared to drop-in centers and mobile clinics. So in most instances, key populations also have options to visit a drop-in center or a mobile clinic. However, we found that amongst the key populations that we spoke to, a high majority or high proportion didn't know about drop-in centers or how to access drop-in centers.
Sometimes people are chased away from facilities and they experienced, privacy violations. There's also, the treatment where people are being driven away from using clinics. I mean, that shouldn't happen in public institutions.
So we, as Richidze, have a few recommendations that we have presented in our report, and some of these recommendations basically include that there should be reports of poor staff attitude or privacy violations or verbal or physical abuse or harassment, and it should be investigated by the Department of Health, and disciplinary action should be taken where possible. And true, we are having key pops who are indicating that they have been turned away from the facility. So, for example, in the highest reports of key populations being refused services were found in Limpopo across KP groups, and a massive 38% of people using drugs in Limpopo indicated that they were turned away from the facility. They were refused access. They weren't helped when they needed the help that they needed.
So, Dr. Kolo, in spite of the monies that go into trying to resolve this problem, the efforts, the training, and everything that you have just described, people are still experiencing the things that both Anele Yawa and Ndevo Rambao have just spoken about. Do you have a plan in place, or is there something? What do you think could still be done to actually address these issues?
All right, thank you so much, Vuyo. I think SANAC continues to be a platform that is used to engage on such issues, because as a coordination body, the Department of Health actually sits at the SANAC plenary, and it's a platform where colleagues like Anele are able to express concerns, and the Department of Health is then able to understand what the gaps, what the challenges are, and these are deliberated extensively at SANAC. And I think from the Department of Health's end, there's also a lot of advocacy, as I mentioned in an earlier interview, that civil society colleagues like Anele, who is part of the civil society chaired by Comrade Steve Letike, where civil society, because we want a situation where our programs are community-led and community-monitored. When we get to a situation, Vuyo, where we are able to look at differentiated models of care and take the services to the people. For instance, the issue of accessing medicines. If going to a healthcare facility is too difficult, whether it's because of stigma or because of the floods in KZN or the lootings, using community halls, using commercial pharmacies and areas that are closer to home, and making sure that services are more user-friendly does improve access and utilization of those services, whilst at the same time trying to make sure that we build services that are friendly to key and vulnerable populations. But I think platforms like plenary are what SANAC allows for us to deliberate on these issues, and for the Department of Health to be held accountable by bodies like SANAC as a multi-stakeholder partner within the coordination framework.
Quick last word from you, Steve, on the way forward on the back of this grant, 8.8 billion rands over the next 3 years.
Look, Vuyo, maybe before I even touch on that, Anele and Ndevo had raised critical issues, and which is then talking about the status of our health system. One cannot run away from the fact that our health system is overwhelmed. And we have to speak about whether the health response in our country has national competency. There's a disconnection between national and provinces or local. And local is where implementation happens. So we need NHI that is very clear on national competency. The second thing, stigma and discrimination. You cannot accept where you have a constitution, where you have the principles of human rights, particularly principles, are not applicable, because it's a question of whether our health professionals are able to charge that aspect, and even dealing with the human resource. I think for me, those key things are clear in terms of the ideal hospital, ideal clinic in adoption. Now, the 8.8 billion is a commitment for the next 3 years. And those next 3 years, it's what we as SANAC are quite clear with all stakeholders, civil society, government. We've got 4 PRs that have mandate in order to grant manage, but also work with community groups, work with NGOs, work with government to actually build and help the health system. The health system cannot always be reactive. We need to invest our effort in prevention, deal with the social issues, deal with human rights violation, prevent all these social behavioral challenges that we're dealing with. But we need society to come on board. Until we deal with behavior in society to prevent gender-based violence, prevent some of these inequalities, we will forever have an overburdened system that is reactionary.
Special thanks to both of you, Ms. Steve Letike, who is SANAC's co-chair, as well as Dr. Thembisile Xulu, who is the SANAC CEO, on the back, of course, of us signing earlier today of a new 8.8 billion rands global fund grant for HIV, TB, and malaria. that fight, of course, continues. We still have a very high number. 7.7 million people in South Africa are living with HIV. Over or close to 5 million are currently on antiretroviral treatment, and there's an estimated 222,000 people contracting HIV still in South Africa every year. And as you heard them there, they were talking about social behavior and how we need to deal with that. And that's where we're going to leave that conversation for now. And after the break, we are in conversation with Professor Thuli Madonsela. Academics, civil society formations, and activists want to put pressure on the cabinet and parliament to effectively tackle the polarizing nationalism and xenophobia manifesting itself or finding expression in issues around employment and business opportunities for foreign nationals. Activities of such phenomena as Operation Dudula and certain political parties like the Patriotic Alliance and Action SA are thought to be further complicating things. Now, Professor Thuli Madonsela is a convener, facilitator of a new program whose broad objective is to explore the social justice implications of both the historic and the recent resurgence of discontent towards foreigners in South Africa. Well, she joins us on the line following a roundtable discussion that she coordinated earlier today. Professor Madonsela, good evening. Thanks very much for your time.
Good evening, Fuya. Thank you for the privilege to join you, and good evening to the viewers.
Well, so many people formed part of the roundtable you're having today. There were, I think I counted 3 sessions which were very focused on the various aspects of this conversation. But to kick off, a conversation I was part of right at the beginning, you heard the Department of Home Affairs talking about, immigration, migration, and the problems that they were having there. And I got a sense from the person who was giving that presentation on behalf of the Home Affairs Minister that by and large, the Department of Home Affairs feels constrained. They feel that there isn't a lot that they can actually do or change. Was that your sense as well, or did I perhaps focus narrowly on the problems that they are having or admitted to having?
Thank you. Well, I came a little bit more hopeful than you did. I got a sense that the Department of Home Affairs wanted us to get a sense of their own parameters. They've got 12 avenues currently for getting visas in the country and staying, plus the opportunity to come in as an asylum seeker and eventually a refugee. They then indicated that some of these they're considering abandoning, and also they are reviewing the economic opportunities because they have a constitutional responsibility when it comes to, for example, freeing the potential of every person, but they have a constitutional responsibility to reduce inequality and end poverty. And they were then saying, or the chief director alerted us to the fact that the resources in the country are limited. And therefore, much as we have to pledge solidarity with the rest of the continent, particularly those in the SADC region as part of our ecosystem, much as we have signed international instruments that bind us to help refugees and again to ensure human solidarity.
Of course, I mean, there's a context within which the department and everyone else who is involved in trying to resolve these problems are actually operating. And that is, you know, we have a big unemployment a problem, with a big inequality problem. So which then are the sort of things that provide this fertile ground for people to then want to find someone or some people to blame. A problem, of course, that can only be made worse by some of the pronouncements and actions of some of our political parties, as well as things like Operation Dudula. Okay, we seem to have lost Professor Madonsela there, and we're going to try and perhaps play an insert which was prepared by our colleague Mariska Botha, who attended the session that Professor Madonsela chaired and facilitated today, dealing with these issues. Have a look.
Madonsela says the dialogue around how immigration is handled in a manner that is socially just remains a challenge. She says immigrants are blamed for social strife, particularly during times of economic difficulties, as can be seen in Europe, the United States, and on home soil.
Politicians mine it as voting fodder, whilst ordinary people scramble for resources, and in the end, social conflict is forever increasing. In this African continent, we are told that the wealth of this continent, or half of the wealth of this continent, belongs to the richest 3 people. And the rest of the half of the wealth of this continent must be shared by the rest. But even then, the bulk of that is shared by only 10% of the people in this continent, and the rest have to jostle for resources.
The South African courts, however, have, on numerous occasions, stepped up, but rulings in court are, according to experts, not always echoed by society as a whole.
The belief that ultimately the law as the dominant social engineer will take care of everything does not only instill a deceitful sense of security into the minds of officials, but also leaves the false impression that personal or moral responsibility is redundant. I want to conclude by expressing the opinion that deciding which kind of society we want to live in is something that all of us have a personal and moral responsibility or stake in. And it's something that cannot be outsourced to the drafters of legislation or to the executive or those who go around controlling shopkeepers and asking for proof of citizenship.
The Department of Home Affairs is at the forefront of immigration matters. It said, among others, that South Africa remains the most attractive destination for asylum seekers, but the country has its own challenges. It says it's not surprising that immigration has become part of the political space, as immigrants are usually the first victims when the economy is not doing well.
South Africa has been responding to this challenge, but we are far from resolving the problem. Platforms like this, where experts they meet to discuss issues of migration, social justice, they are very important for the country as a whole. Obviously, these dispensations and other interventions, they are not sufficient, Chairperson. In 2017, Cabinet then approved the white paper that is trying to respond to this issue.
In his discussion, Judge Dennis Davies said the country's entire economy was built on the shameful exploitation of migrant workers, both nationally and from neighbouring countries. He warned that the views and actions of certain political parties can only be described as xenophobic.
And the real question is, will the government have the commitment to our constitution, the bravery to stave off these xenophobic attacks, and in a sense a commitment to a migration policy which ultimately was what we thought we were doing in 1998. And I'm afraid to say that the trajectory is the other way.
The outcomes of the expert roundtable discussion will include a submission of a policy brief to Parliament and a research paper. Mariska Botha, SABC News, Cape Town.
Wow. Mariska, of course, attended that roundtable that Professor Thuli Madonsela facilitated, and we have her back on the line. The Prof, before we lost you, I was talking about some of the issues that Mariska speaks about in that insert, that in spite of the numerous problems and the fact that, as the Chief Director at Home Affairs said, we are far from resolving our immigration problems. In the meantime, we have a lot of our compatriots blaming immigrants, for the problems that they are experiencing.
Indeed, my apology for the short blackout. Mr. Mtiane Sihle did point out that we're still a long way when it comes to a strategic response to the immigration challenges, and whilst ensuring that whatever we do is in line with our regional integration commitments, international obligations in terms of refugees and immigration, and our constitutional obligations. But he did assure us, though, that the white paper is acutely aware of these challenges and offers the best options that government thinks are available to move forward. And it's now up to us to comment. And indeed, in the room, great comments came through, including that one from Professor Smith, that indicates that as long as the people are not part of the social compact on immigration, we'll be skating on thin ice, basically.
But an important thing that is or was raised by Judge Davis is, the commitment by notwithstanding your optimism, it seems to doubt the commitment, of the government to a migration policy that would hopefully deal with these issues once and for all, or at the very least give us, the best outcomes, and whether they are also, government is also prepared to tackle head-on the issue of xenophobic attacks.
Indeed, that was the view of Judge Dennis Davis, and it was shared by many in the room, that when it comes to xenophobic attacks, there has been impunity. And many of the speakers, as you saw, the majority of the people in the room were experts, and they were basing their comments on research that they themselves have done. And it does seem that accountability for the atrocious crimes that have been created against non-nationals does not seem to be happening fast, which therefore encourages people to attack. But one thing for certain, there was sort of a sense of agreement with government that there is a need to regulate the sharing of the limited economic resources and social services. And therefore, you can't just have open gates. You need to have some kind of sifting process. It's just the question, is what is being put on the table enough? And secondly, why is government not enforcing existing laws? Because, for example, the fact that you have a lot of undocumented people has to do with government's own failure to enforce existing laws.
Now, the situation, of course, is not made worse. I mean, is made worse by, phenomena such as, what we're seeing people behind Operation Dudula are doing, pronouncements and programs of certain political parties, like your action essays, your patriotic alliances. That also came through quite forcefully, I understand, from the conversations.
Certainly, experts did point out that having vigilante movements such as Operation Dudula does not solve the problem. In any event, injustice cultivate further injustice. What was pointed out was that government needs to enforce the laws. I think we had the Ghanaian High Commissioner who said it was important that existing laws be enforced and that there was nothing wrong with restricting certain aspects of the economy to locals. For example, Ghana restricts the entire retail sector to locals. But it's wrong to let citizens enforce the law on their own or to resort to self-help. So two things that seem to have emerged as solutions. Number one, government should enforce existing laws appropriately so that there is the rule of law and therefore citizens don't need to take the law into their own hands. But secondly, citizens who harm others just because they're non-nationals should be subjected to two things. One, people need to be educated about their responsibilities to each other, shared humanity, human rights, etc. But secondly, there must be consequences for harming other people and for breaking the law as you do so.
Of course, I mean, you weren't talking for the sake of talking or because you can. You have some thoughts about how to take this process that you engaged in today forward.
Certainly. The end product for us is to design laws that have a desired social impact. And therefore, we are going to submit to government a policy brief on how to take immigration law reform forward. We also will submit the report of the entirety of this discussion by experts, but it's also available by link online should anybody want to listen to these amazing insights that came from the experts in the room. And then we also want an ongoing conversation. We will be cultivating an ongoing conversation as part of our Musa plan for social justice to get civil society on board so that there is an element of the social compact that deals with these issues of immigration. And one of the difficult issues, Vuyo, that wasn't dealt with adequately in the room, and we'll deal with it next week, Wednesday, at our Social Justice Cafe, is statelessness. And one of the presenters spoke about 18-year-olds up to 35-year-olds that have never been to any other country. And their only crime is that they are children of parents who mostly came here legally, but then had their documents expire. And now they're not citizens of any country. They can't go to university. They can't open bank accounts. They cannot function. And to deny them these economic opportunities and yet have them be consumers is not good for them, no good for the economy. Which takes me to another issue that came out, was that not allowing refugees to work or to open up businesses doesn't make sense, because once we've allowed a person to function in this country, they've got to find a way of earning an income and earning a living, because otherwise then they are a burden to the economy, or you're inviting them to resort to crime.
Now, whatever brief you will be able to come up with and put, out there, some of our problems as a country. One, even where we, from the time we tried to pilot legislation, the mills there tend to grind very, very slowly. And even when we get to a point of adopting or reaching consensus, around these things, implementation is always, a problem. And as we have been saying throughout, those, who are keen, to use the opportunity for their own selfish, interests, will be hell-bent on whipping people's emotions, are not going to stop, because their agenda is different. Have you sort of looked at how to deal with those challenges that all of us are only very familiar with?
No, certainly that was part of my opening remarks about how immigration issues are weaponized to win elections. And it's not just in this country. We've seen it in the US, UK, and we've seen it in some of the European countries, the last one being France, very recently. So that is not going to stop. However, for parties that are in parliament, me, you, and everyone else have an opportunity and responsibility to use the parliamentary process to exercise social accountability, to say, if you are a party in parliament, then you have signed to uphold the Constitution of South Africa. You cannot, therefore, say certain things that are contrary to the human rights ethos in the Constitution and the social justice commitment in the Constitution. So we can hold those accountable and even request that they be taken to account or be held accountable via the Parliamentary Code of Conduct, or if they're ministers, via the Ministerial Code of Conduct. So we can do something about it. It's obviously those who are not yet in Parliament that we can obviously criticize them through the media and maybe even hold conversations with them directly. For example, at this forum, we had invited people such as Mr. Mashaba and Operation Tudula. Unfortunately, they couldn't come, but we would like to engage with them because the real issues of sharing resources are real. We're not saying there aren't any concerns around how we're handling immigration. We're just saying none of it justifies vigilantism and the injustice of torturing, burning people and destroying their property.
That's where we're going to leave it. Thank you very much for your time this evening, Professor Thuli Madonsela, who convened that roundtable that took place at Stellenbosch University, trying really to collate as much information as possible, but not for the sake of it, but with a view of getting your legislature, that is Parliament, as well as your executive, the cabinet, to really take these issues seriously, because the polarizing nationalism and xenophobic attacks that are manifesting themselves in issues around employment and business opportunities for foreign nationals are in fact taking the country back and are helping no one. So we all need to have a full understanding and appreciation of the problems and put blame where we should put it. And as she was saying, violence and attacks are not going to help the situation at all. Hopefully that initiative will have some legs. And Today, of course, being International Nurses Day, as a program from all of us here at the Watchdog, we would like to pay tribute and thank our nurses who have been risking their own health, but also at times, life and limb to take care of the rest of us when we can't take care of ourselves. We're saying to them, keep doing the good work that we have been doing, and we wish you the best of luck. From the opportunities to remuneration to being protected, may all of the people who have the power to ensure that you're taken care of do so indeed. And happy Nurses Day. And that's our show for this evening. Have a good night. Do join us again tomorrow night, same time.